Hey there, it's Lenore, and thank you for scheduling your Medicare annual enrollment appointment. This is a little checklist that we put together so you can have the best appointment possible. The first thing we want to make sure you do is complete our scope of appointment. Medicare compliance requires us to get this form completed by you. It will be sent out to you by email. It's very simple. You're just going to fill in your zip code, your date of birth, and then you'll be able to type your name and hit submit. That allows us to review the plans that are available in 2026 and make any necessary changes. The second thing we want to do is make sure that you update your information in our self-service portal. This is sort of like your portal with your doctor, your hospital. Maybe you've used this kind of technology before. It's very simple. We need an updated list of your current doctors, your medications, and please make sure you include the dosage and the frequency of the medication. So for instance, my medication is atorvastatin. I take 40 milligrams once a day. So you want to make sure that you have that list available and you update it in the portal. Then we're going to go through some new stuff. We have been working really hard. We know this is one of the most disruptive years for Medicare ever. Costs are going up. We're looking at ways to protect people from costs maybe that we didn't do in the past. That's called our umbrella coverage, and we're going to go over that in a minute. And then once we go through all of the checklists, we're going to identify the policy and make that recommendation and make the change. All right, so here's what we can do during the annual enrollment period. This is just a refresher, and for those of you who have a Medicare Supplement Plan, we don't necessarily have to change that plan during the annual enrollment period. This is the time when we can switch from Medicare Advantage back to Original Medicare. We can also switch from Original Medicare to Medicare Advantage. We can switch Medicare Advantage to Medicare Advantage. We can join a Medicare Part D drug plan, or we can switch from one Part D drug plan to another. Most folks will be changing from Advantage to Advantage or Part D drug plan to another Part D drug plan. Those of you who are looking to switch those kinds of options, we can go through those with you, but these are the ways, these are the things we can change in the annual enrollment period. Just a quick refresher, we really have two ways to have our Medicare. We can have Original Medicare A and B with a Medicare Supplement Plan, also known as Medigap, and a Part D drug plan. Or we'll have Medicare Part C, like Charlie, that combines Part A and B, and that would likely include your prescription coverage in the Medicare Advantage. Now, keep in mind, no matter which option we are in, you're still paying your Medicare B premium. So let's just go through these options side by side. A lot of you have the Medicare Supplement Plan. You're paying your Medicare Part B premium and the cost of the actual supplement. We don't, that's based on your age, whether you're a man or a woman, and where you live. These types of plans give you the lowest out-of-pocket cost. So you have a monthly premium, but very little out-of-pocket when you see a doctor or have a hospital stay. They also give you a network across the whole United States. There really are no networks or referrals with the Medicare Supplement Plan. You can choose your doctor, and mostly all doctors take Medicare. You will need a Part D drug plan, and that's this time of year that we're reviewing those. We'll choose one. It's called a standalone drug plan, and we're going to match the plan to your particular drugs. The other option we have is known as Medicare Advantage. Now, this is also called Part C, like Charlie. Again, either option, you're paying your Medicare B. With this option, typically we have a lower monthly cost and higher out of pocket. So you have copays when you see doctors, specialists, hospital copay. Those are the kind of things that we have with Medicare Advantage. And the coverage level, either an HMO or a PPO, We have a network of doctors. We're going to choose doctors in network to get the best pricing we can have. So this type of a plan is based on where you live geographically. It doesn't have the same flexibility as a Medicare supplement plan has with regard to network. Typically, though, this plan will include your hospital, medical, and prescriptions in one plan. And some of the plans are including dental, vision, gym, and over-the-counter benefits. We're seeing less of those in the coming year. So those of you who are looking for those extra benefits, we have some solutions there. All right. Now, this again we're seeing costs go up across the board for most of our clients. And this is one of my clients who sadly passed away from cancer. And we are now recommending the cancer, heart attack, and stroke coverage for our clients simply for the reason we're seeing an uptick in these types of diseases due to people putting it off through COVID. So we recommend that you have the cancer policy to help pay for some of the things that Medicare doesn't cover, unexpected costs like high cost of prescriptions, travel to and from a facility. Maybe you want to go to a premier facility, not in your neck of the woods. Maybe you want to pay someone to come in and assist you with some of the things you can't do after recovering from cancer or heart attack or stroke. You want to pay a family member to do that. And then, of course, we have some experimental treatments or non-traditional treatments, especially with cancer, that aren't covered by Medicare. So we are recommending these policies for clients. Additionally, we have skilled nursing coverage. And again, these are my clients who sadly we weren't able to get them in a skilled nursing policy. A while back, we had sent out a survey and we had a really great response to that survey for the long-term care product, which we still have options there. But in some of our states, we have a skilled nursing benefit that will assist with the out-of-pockets that Medicare doesn't cover. So if you remember, Medicare is covering the first 20 days in a skilled nursing facility. Days 21 through 100 would cost you about $210 a day. If you have a Medicare supplement plan, it will pick up to the 100 consecutive days, but past 100 days in a skilled nursing facility, you are responsible for the entire cost. So this is a really great option with very easy underwriting. In some of our states, we're able to offer this to you as a client as an extra layer of protection. And I wish I had offered it to my friends here, Barbara and Neil, who are currently having issues with the cost of being in a skilled facility, paying out of pocket, going through their own personal savings. This is the Medicare and You book. I just want to point it out. This is the 2025 version, but it is right in here in the book. If you read at the top, it says hospitals are now required to share the standard charges for all items. We go into the sometimes doctors will keep you as an outpatient for observation services when they admit you. We have skilled nursing right here. This is what I wanted to talk about on this slide. Medicare covers skilled nursing facility care after a 3-day minimum medically necessary inpatient hospital stay, not including the day you leave the hospital, for an illness or injury related to a hospital stay. Medicare covers semi-private rooms, meals, skilled nursing, and therapy services and other medically necessary services. So really, you're not covered for everything, and sometimes you want to go into the skilled facility before the 3-day minimum. Sometimes you're in there and you're not approved by Medicare for those. And these are out-of-pocket exposures that we can help you with by adding what we are calling our umbrella policies. So those of you who have been with us for a while, this is something new that we just started introducing. We are recommending not just having a Medicare supplement with a drug plan, but adding on a cancer, heart, or stroke policy, the dental, vision, hearing, and the recovery policy. Those of you who have Medicare Advantage, our umbrella 3 is really almost non-negotiable. We want to make sure that you have the protection you need, because with the Advantage plans, you are on the hook for 20% of those cancer costs up to the out-of-pocket max, which is somewhere around $7,500 to $12,000 out of pocket, and that resets every year. So we don't want to leave you unprotected. We are recommending our umbrella policies. A lot of folks will ask for that dental and vision coverage. We're happy to give it to you. However, there are some overlooked benefits like the critical care, or what we call recovery care, along with the cancer and stroke policies that we can assist you with. So I am looking forward to the appointment. Remember, we have some new folks scheduling those calls. We also have a push for you to go and apply on your own. Thanks so much.